the national capital, the resident doctors at AIIMS in Delhi will provide elective OPD services outside the Nirman Bhavan, which houses the Health Ministry, amid protests over the rape and murder of the trainee doctor in Kolkata's RG Kar Medical College and Hospital. The doctors have stated that their strike would continue and they will provide free elective OPD services of around 36 specialties to patients outside the Nirman Bhavan at 11 a.m. today. The doctors maintain that it has been unanimously decided to continue the strike as their demands remain unaddressed. However, they have in fact added that they will be available for providing elective OPD services to patients outside the Nirman Bhavan, adding that emergency services will continue as before at the hospitals. The RDA has further requested the central government to provide necessary arrangements for the elective patient services outside the Nirman Bhavan. The doctors have of course been on an indefinite strike since the 12th of August, suspending all elective and non-essential services including OPDs and wards. They've been demanding for justice for the victim and a security act by the Centre for Medical Professionals as well. With me on the broadcast is my colleague Brian Anthony Thomas. Brian, you were of course at the Nirman Bhavan even as we speak. These free services are to commence at around 11 a.m. Today. Meanwhile, we've seen how the doctors, we've spoken to them as well, how they've come out to the streets demanding justice, demanding an overhaul as far as the system is concerned. They've called for enhanced security in hospitals as far as deployment of police camps, a number of CCTVs, functional CCTVs as well, and ensuring a central law to ensure the safety of doctors is concerned. Now, of course, they will be providing free OPD services as well. It seems Brian is not with us on the broadcast. We'll try to get Brian's connection with us. We also have Dr. Bibhu Anand, who is the National Joint Secretary of the FAIMA. Good morning, sir, and thank you for speaking to us on NewsX. We've heard the doctors earlier as well. We've spoken to a number of doctors who are at the site protesting, and a demand for a central law has been consistent with regards to the safety and security of doctors who especially work 36-hour shifts, work over the course of the night, are continuously engaged in saving lives. We've seen how this young woman doctor who spent 36 hours saving the lives of people had her own life taken away so cruelly. What would you like through this medium to tell the people of the country and as well as the government?
Good morning, everyone. The thing is that the condition is very much pathetic, and unless until the Central Protection Act for healthcare workers comes in law, these things will happen repeatedly once in a while. And this time we would not give any step backward, because any step backward will be just like every time happening of being highlighted for a while and then forgetting. As any incident happens, this comes to highlight and it comes to media, and everyone talk about this, and after few days the things get settled down, and when people start to forgetting this, and the assurance given by the government for the law is no more exist after the settlement of this strike or everything. So this time we are very much on the step that we will not step backward in this case, and we will be just unless until that Central Protection Act for healthcare workers comes in law, or we will give any written assurance about this, we will not step backward, and we will not see this mishappening to get again, and we will start again having a strike for justice. This time we will not accept this, and we will give our strike. We will take our strike to the last breath till we don't get that Central Protection Act for healthcare workers, and along with the justice, to the case what has happened today. We are going at Nirman Bhavan at 11 a.m. and we along with the AIIMS RDA and also other doctors of the hospitals of Delhi, we are proceeding to Nirman Bhavan at 11 a.m. and we will be sitting there and we will provide free OPD services to those who wants to come, and they can come at Nirman Bhavan. We will be giving them free OPD services, but this time we will not accept anything below that Central Protection Act, and along with this we will fight for the justice of R.G. Kar Medical College resident, which was so much pathetic of this condition of brutal rape and murder. So we want justice for that also, and we want fast, speedy trial and punishment to the culprit. So we will fight for it, and also we will fight for the Central Protection Act, because we don't want to repeat these things in coming future.
Indeed, sir. And meanwhile, the centre has formed a panel to assess security measures. Do you think this is at least one little encouraging step, considering that there is a long way to go? Several demands have also been put forth for ensuring police camps at hospitals, for ensuring that CCTVs are put as well. We know for a fact that the CCTVs at the R.G. Kar Medical College and Hospital, they were not functioning that night as well.
Yes. Actually, the thing is that every time when things happen, the government and the police or the administration generally takes it when the strike is big and when there is more hampering of the services. The government takes action, just a step to calm us down. And after when the strike gets calmed down and the topic of this gets away from the highlight, then the things go on very slowly, and the assurance given at that time just not get fulfilled. So it's very much happening every time. So we can't get our colleagues' life at risk every time. So this time we are very much assured, and that our strike will go till the breath we take to get our Central Protection Act for healthcare workers. So we will not accept anything below that, and we are going for it, the strike. And it's not that we are just in confrontation of the government. Actually, we are not confronting them. We are just want our justice, because every time the things happen and the government gives something like just what I can't say it fake, but just like something that is not fulfilled after the case ends. So why not wait for that? Just give that Central Protection Act for healthcare workers as soon as possible in the parliament, and to make it a law as soon as possible, because it is for the risk of the life of the doctors. And the government should come in one platform. The opposition and the government should come in one platform to pass this law and make it as soon as possible, so that these things will not happen in future. We don't want to delay, so that our colleagues and the doctors or the healthcare workers who are facing this misbehavior or having that vandalized by the goons. So we don't want these things to happen again and again and again, striking, again hampering the services. So why not this time? Why wait for the next time?
Indeed, as you've aptly put it, why wait for another life to be taken very cruelly away?
For more such videos, subscribe to the NewsX YouTube channel, hit the bell icon.